Childhood trauma often has devastating effects on psychological functioning in adulthood that often translates to significant psychosocial and even forensic consequences. If you think about childhood having stability, knowing that you're protected by your family and other organisations around you, allows you to form solid and safe relationships later in life, really have an intact sense of who you are. Now, this is the ideal definition and experience of childhood. But we do know that the reality of many childhood experiences is that this is actually not the case. And the effect on the rest of their lives is in stark contrast to what ideally we think childhood should be about. Childhood trauma can take a number of different forms. It can be physical or sexual abuse, the witnessing of a traumatic event, even having a severe illness requiring surgery, hospitalisation and separation from your caregivers, witnessing domestic violence, or experiencing intense bullying. Now, as adults, we often struggle to process these life events. But if you think about a child's eyes, they don't have the necessary brain development to really understand and process these. They really rely on safe relationships with adults around them who can process these for them. And that's often not present and not the case. So children don't filter information through the prism of education and socialization and life experience the way that we do. And oftentimes they will blame themselves because they have no other point of reference. It's intrinsic to personalize difficult events and think, well, that must have been me. Childhood trauma has a significant effect on guilt, shame, and stability. It chips away at a child's sense of self, undermines their self-worth, and often stays well into adulthood and throughout life if it's very severe. Trauma can also impact a person as they experience feelings of shame and guilt, which can be reactivated in difficult or troubling circumstances. They might also feel disconnected, struggle to relate to others, but in particular have trouble controlling strong emotions, have heightened anxiety, difficulty managing anger, and often difficulty managing and regulating mood. In adults, there's often significant attachment disorders that can present. If there's a child that experiences parental abuse or caretaker abuse, it will significantly disrupt their attachment style, which will play out as a partner, as a parent, as a colleague, and as a member of society. People may develop a dismissive or avoidant attachment style when a caregiver ignores or rejects a child's needs. This child will often be pseudo-independent in adulthood and really struggle to connect and really see the needs of others to protect themselves from rejection. When they're exposed directly to abuse and neglect, they can develop a fearful avoidant attachment. They'll fear intimacy and close relationships. They'll be distrustful, have a really difficult time managing and sharing emotions, and can seem disconnected from partners, children, and others around them. Or they may also develop a more anxious and preoccupied style of attachment when they'll be clingy and needy, require repeated validation in relationships, and never really feel entirely secure. And this will often stem from a childhood with significant inconsistency and disruption. Exposure to traumatic events can not just cause poor self-esteem, can also cause significant self-destructive behaviour, difficulty regulating emotions, which can become more problematic with age, as traumatic events in childhood can result in adverse effects in adulthood and can often be reactivated through life stressors and difficulties that occur in adulthood. Adults who experience trauma as children are much more susceptible to major depression and other mood disorders, as well as thoughts and acts of self-harm. We also know that there is a link between childhood trauma and the presentation of other major psychiatric illnesses, such as bipolar disorder and even schizophrenia. So people that have vulnerabilities to major psychiatric illness can have a deleterious effect of childhood trauma on brain development that then modifies or triggers a more complex major mental illness in adulthood. Now, additionally, many individuals who suffered trauma as children, particularly if repeated or prolonged, can have a chronic form of post-traumatic stress disorder, which has been much more widely recognized in the mental health field in recent times. So people with what's called complex or chronic PTSD will tend to experience the core symptoms of post-traumatic stress, such as nightmares, intrusive recollections, hypervigilance, etc., but also disturbances in their thoughts and behaviours and emotions, such as difficulties expressing emotions, people often losing control of emotions, such as explosive anger, persistent sadness that results in withdrawal. They can have a negative self-belief, where they'll view themselves in a negative light and will feel helpless, guilty, or ashamed. And due to a lack of trust, have significant problems maintaining healthy relationships. People may avoid relationships completely, or they may develop very unhealthy relationships, which might be incredibly intense. They might recapitulate or reenact their own abuse in a partner or parental relationship as a way of trying to kind of work through or process that problematic relationship. And people will have often ongoing feelings of emptiness and hopelessness, even lifelong. People who've experienced childhood trauma are much more likely to abuse alcohol and other substances because they have much more limited internal resources to manage those difficult emotions. So they're much more likely to develop significant substance abuse disorders, which can have understandable forensic implications. But even from a physical perspective, people with childhood trauma are much more prone to developing chronic illnesses, even cancer, heart disease, diabetes. We know that there are biological effects of trauma on things like heart rate variability, how the brain regulates the autonomic nervous system, which predispose people to a range of chronic health illnesses. People with childhood trauma are actually more likely to have an early death, not just through self-harm or misadventure, but through substance abuse, higher rates of smoking, higher rates of chronic inflammatory disorders, etc. So really you can understand that with the persistent emotional dysregulation that often results from childhood trauma, that people who've experienced this to almost any degree have a consequence in adulthood that affects particularly relationships, which is going to have a broad range of effects on social, occupational functioning, and in particular interpersonal functioning. So people's roles as a member of society, as a member in their workplace, in the community, but also as a partner, as a sibling, as a parent and grandparent, is often going to be significantly disrupted in an enduring way by childhood trauma.